Okay, we are live here at the Body Project. I'm Rob Smith, and I am with a wonderful client, Olivia, here. And tonight what we're going to be talking about is posture. We've been talking about breathing, and we actually are going to integrate a piece of the breath work tonight as well. Olivia, why don't you tell everybody why you came to see me in the first place?
So there was about a month at the beginning of the year that I had no functional use of my jaw. I couldn't open it more than like that. I couldn't even bite a sandwich. And so I tried a couple different things that I thought maybe would relieve it. Week after week, nothing was working. So I decided to come and see someone who knew what they were doing. And over the last couple of weeks, I have a full mobility now, which has been awesome.
So in terms of posture, everyone thinks about aesthetics, but there's so many orthopedic challenges that will actually manifest from suboptimal length tension relationships. All that means is bad posture or muscle imbalances. So let's have Olivia lie down and we'll kind of walk you through what was going on with Olivia. So the first thing, it was her jaw, but rather than isolate or compartmentalize this area, the first thing I took a look at is what? How she was respirating. So when we first started with Olivia was really a vertical breather. Now Olivia's got a history of asthma, and so that's something she struggled with. And if you think about an asthmatic attack, people are going to go very vertical, okay? So she has neurologically conditioned herself to be more of a vertical breather. She's had to work really, really hard to help retrain this. So Olivia's problem was right here in this lateral aspect, this jaw musculature here. And she had a tremendous amount of trigger points in this area. And so there was a specific muscle that actually opens the mouth. It's called the pterygoid, the lateral pterygoid. So that particular muscle is what allows you to open up your mouth. So when I evaluated how Olivia was respirating, we identified, of course, she was a vertical breather. And so the first thing I wanted to see is, did she have any trigger points in her diaphragm? So upon palpation, what did we find?
I did.
It was very, very tender. And so as I palpated, I asked, which was tighter? Was this more tender on this left side, or was it more tender on the right side? And she had a really nasty trigger point right here. Now remember, a trigger point is gummed up, balled up tissue. If you think of this as optimal length in the tissue, a trigger point is gummed up, balled up tissue. And what happens is it traps all the blood flow. pH balance changes, you become very hypersensitive to any type of pressure. It was very painful here. Now, the interesting thing about this is the opposite, our contralateral side, is then always affected. So when we got into this lateral neck musculature, we found she was very, very sensitive on the left side. So what did we have to do? And Olivia loved this. We actually had to go inside. We had to go inside her mouth. And so, go ahead, open. So I actually had to work on this trigger point here, close. And when we first started with this, take a look at her feet. Why don't you simulate your little feet? She was all over the place. It was very painful. And these trigger points can be very uncomfortable. And so what we did is we worked to really release these trigger points. Now here's the thing you have to understand. If we would have went in and only worked on her jaw, what we would have done is we would have decreased the trigger points and she would have got some nice relief. But the thing is, if you don't identify the root cause of the problem, which was a dysfunctional respiratory pattern, then we're just going to be chasing the pain, meaning this could come back. Olivia's done an outstanding job working first, okay, let's do a breath. Working first to establish that diaphragmatic breath, we'll go lateral. And then now she's really working on this lateral expansion. So one of the things we also notice is around Olivia's rib cage right here. And for the camera, you can have a little effect. Is that tender?
Yeah.
So very tender. So these muscles that surround the rib cage, and they help with rib cage expansion. We have trigger points here. A lot of times we're gonna find the trigger points through the rib cage. And so Olivia's doing a beautiful job now expanding laterally through her diaphragm. But if we don't break up these adhesions through her intercostals, she's not gonna really be able to get this nice lateral expansion through her rib cage. Therefore, she's not getting full capacity. Now, if this area continues to be adhesed, it puts more stress on this neck musculature. Now, the one thing we talked about, you remember how we talked about your posture? So remember, from a lateral view, we want the ear, the shoulder, the hip, the knee, and the ankle. That should all line up. And what did we find out with you? The head, the ear is what?
Forward.
A little bit forward. So because she's developed this tight musculature, because of, remember, these muscles up here and through here are what are called accessory respiratory muscles. This is your primary respiratory muscle, your diaphragm. So when the diaphragm is not being engaged, you overwork these accessory respiratory muscles. These become your primary respiratory muscles. They're very small muscles. They become overworked. It can lead to neck pain and jaw pain and shoulder problems. TMJ, it's really painful. Now, recently had a gal that I worked with that had the exact same pattern as Olivia. And when she went in, she saw two different specialists. They wanted to break her jaw. That's what they were looking at doing. And so this was painful, but much less painful than breaking your jaw. So just remember this, that when we look at an orthopedic problem, any type of joint pain, we never want to isolate or compartmentalize. What we want to do is we want to take a holistic approach at how the body is functioning and determine what truly is the root cause. And so if your muscles are unbalanced, i.e. poor posture, orthopedic problems can manifest. So don't just think posture as only an aesthetic piece. Think of it as a functional piece that can actually dictate whether or not you're functioning at a high level, whether you're in pain or not in pain. And so in the course of our 28 days, obviously tonight we're speaking on posture. We still have a little bit more to cover on posture, so stay tuned, and I'm going to continue going down this path. We're going to discover some other muscle imbalances that can lead to knee problems and back problems and hip problems. So if you got value from this, if you learned anything, please like the video, share it with a friend or a family member that you think may get some value from this. And until I see you tomorrow, stay well.